Why I want to talk about HIV while we're waiting for the result is because it used to be known as a gay disease or men who have sex with men or intravenous drug users. It is not so anymore. It is happening to heterosexual couples. It is happening to children who have been passed down from their mother who got infected. The girlfriends and the wives get the HIV infected from their husbands or their boyfriends or their lovers. Being HIV positive, it's not a death sentence anymore. You have medication, you have latest technologies, you have the resources to help with the HIV/AIDS patient. But in Burma, Myanmar, it is still a death sentence because there is no spending on the healthcare. There are only a handful of HIV/AIDS clinics in Myanmar. One of them that I have visited is run by ex-political prisoner Dr. Putin. She literally opened her small house for HIV/AIDS patients who come from different parts of Myanmar to get treatment. There are very few people who I think highly of them and who I applaud for their action, and she's one of them, because back at the time when she didn't have any funding from NGOs and other organizations, she took the initiative to provide refuge for HIV/AIDS patients coming to get treatment in Yangon. I have visited the clinic. It is literally a makeshift hut throughout the compound for HIV/AIDS patients because she didn't have any funding. She provides not only shelter but also food. She makes sure that they get their medications on time regularly, because HIV/AIDS patients needs to have their medication on time and regularly and not miss a single day of dose. Most of the time these HIV/AIDS patients, they don't have relatives or know anybody in Yangon, so they have a very difficult time staying and getting their treatments and getting the medication, and most of the time they can't go back to their villages because they always have to come back and get their treatments, medication like 30-day treatment or 60-day medication. Transportation cost is very expensive. I have been to one of these clinics, and whenever I do, I always urge people to go and visit these clinics and learn about them. HIV/AIDS is not an easily transmittable disease. There's only two ways that it can be transmitted. It is through semen and blood-to-blood transfusion. You can't get HIV from hugging or handshake or having lunch or dinner with them. So it is not that easy communicable disease. And when you visit the clinic, you can provide funding, you can provide donation. I don't have a lot of money, but I try my best to provide donations, provide encouragement. I usually bring a little teddy bear or something to give it to the patient, because most of the time their energy levels is very low. A lot of these HIV patients, they believe that it is a death sentence, that they are going to die. Those HIV patients who do not get treatments, they will die. Very important to get their medication daily and on time as well. I would strongly encourage you to visit, because it doesn't matter whether you're Christian, Muslim, Buddhist, atheist. It is an honorable thing to provide comfort and emotional, physical, financial comfort to those who are weaker than us, who are not as strong as us, who are in a worse state than us. So I would encourage you to do that as well. What I'm trying to do right now is this is a bad analogy, but it is what it is. HIV/AIDS patient in Burma is sort of like Titanic. The boat is sinking. Some of them will die, and I'm trying to get as much lifeboats as possible to Burma, to these HIV/AIDS patients, to save these people. So I want you to help as well. Whether you're Burmese, non-Burmese, whether you're in Burma or visiting Burma, get awareness. Help as much as possible. In a country like Burma, where it's very little spending is spent on education and healthcare, it used to be that the government spends about 1% or 2% of GDP on healthcare and education. Even in developed countries, they spend a lot more money on healthcare, not just for maintaining people healthy, but also for research and other healthcare programs. I would really encourage Ministry of Health to spend more on healthcare and education, work with other NGO organizations, international NGO organizations and other governments to improve the healthcare, the expertise, the knowledge, but most importantly, the funding needs to be spent more on healthcare. The second thing is awareness programs, not just in cities but also in rural villages. There should be awareness, and getting the tested, and awareness programs should be initiated. And the third thing is, for those people who are infected with HIV or cancer or any form of disease or illnesses, they should get the necessary treatment, the best necessary treatment as possible. And for that, they need a lot of help as well. So some people would say that, how are we going to pay for these programs? programs, unless you get a donation from other countries or other NGOs. But Myanmar is a rich country. It has a lot of natural resources, like it has a lot of gems and jewels, it has oils, it has wood that they can teak. They have a lot of these natural resources that they could be used on healthcare and education. The responsibility, the job of the government, if anything else failed, the job or responsibility of the government is to take care of its people in healthcare, education, and make sure that everyone in Myanmar is safe and sound and protected. That is the job of that is why the civilians, they pay taxes to the government. They have to pay taxes to provide these. Even if they can't pay taxes, it is the one most important job of a government to provide security for its citizens. That is why I'm really encourage the Myanmar government to take these initiatives. Be proud of the fact that you are doing these programs. Be proud of the fact that yes, despite all the difficulty, despite all the hardships, that you are taking care of its own people. We might be poor in Southeast Asia. We might be the poorest country in the whole world, but we are proud that we take care of our own people. So my message to the Ministry of Health, and not just to the Minister of Health, I'm just talking about in general, the Ministry of Health and all the other branches of office, the government branch office.